Today, I'm going to begin by doing the cardiovascular assessment. I'm going to introduce myself to the patient. Hello, Kevin. My name is Danielle. I'm going to be your nurse today. I'll be providing you care. I'm going to pull the curtain to provide you privacy. And I'm just going to ask you your name and date of birth.
Kevin Smith,
And date of birth.
7/9/99.
Next, I'm going to perform some hand hygiene. And then I'm going to assemble and clean my equipment. The procedure that we're going to be doing today is just cardiovascular assessment. I will be listening to your heart and assessing your pulses throughout the body. And if you can just sit as you are throughout this assessment. I'm going to ask you two history questions. Any chest pain?
No.
And do you have a family history of any cardiac disease?
Heart attacks.
On which side of the family?
My father's side.
Okay. Next, I'm going to just palpate the carotid artery and note the strength bilaterally. Okay. Next, I'm just going to listen to your carotid artery and use the bell of my stethoscope. Okay. Next, I am just gonna inspect the applicable impulse. So I'm just gonna listen to that, and that's gonna be where I'm gonna be listening is gonna be at the 4th and 5th intercostal space. Okay. Next, well, in doing that inspection, I'm gonna listen for any lifts or heaving within that pulse. So no lifts, no heaving. Now I'm gonna palpate that same pulse. I'm gonna feel with one finger at the 4th and 5th intercostal space. Okay. Now I'm gonna palpate for the pericardium for pulsations. I'm just gonna feel with my fingers starting down at the bottom of your heart, the base of your heart. Next, I'm gonna listen to the same pulse, the apical pulse. I'm just gonna note any rate and rhythm of your heartbeat. Again, this is gonna be at the 4th and 5th intercostal space. And heartbeat is normal. Rhythm of heartbeat as well as normal. I'm gonna now listen to your heart, and it's kind of like a Z pattern. And I'm just gonna listen to each spot and kind of verbalize what I hear. Starting with the S1, which is normal. S2, which is normal. S3, S4, And I'm gonna listen to the apex of the heart, which is at the bottom of your heart. Which also has a good strong heartbeat. No abnormal rhythm. And now I'm gonna listen to any of the extra heart sounds using the bell of the stethoscope, and this is just looking for any heart murmurs at the S1 site. And then S4. So no heart murmurs. I'm also going to listen for any aortic regurgitation at the base of the heart. So no aortic regurgitation. Now I'm just going to look at your upper extremities. I'm just going to inspect your arms, look at the color and the size, and see if there's any lesions or redness. So inspecting both of the arms, there is no redness or lesions. Color is pink, size bilaterally is normal. I'm also going to inspect the nail beds. What I'm looking for is on your pointer finger to see if there's any angle that's above 180, which is normal. Next, I'm just going to palpate the pulses bilaterally to assess a rate and a rhythm. So I'm just going to look at the radial pulse and the brachial pulse. And radial pulse is normal +2. And brachial pulse is again normal +2. Next, I'm just gonna palpate looking at like the temperature of your skin and the texture of your skin. So I'm just gonna use the back of my hand. Okay, so skin texture is normal, not dry. Temperature is normal as well, not hot or cold to the touch. And then I'm going to just assess for any signs of dehydration. So I'm just gonna pull this down just a tad and assess the skin here over the clavicle. Okay, no tenting noted. I'm gonna look at the lower extremities now. I'm gonna inspect your legs for the color and size, again, any lesions, or if there's any different skin changes. So no skin changes, no lesions, no redness to either leg. And I'm gonna inspect the toenails and in between the toes. Again, appears to be normal. No skin tearing. Just gonna palpate the temperature by using again the back of my hand. Which again, no hot, no coldness. Temperature is normal. I'm just gonna look for any signs of edema now. Any pitting. So no pitting noted to the PDO. No pitting to the ankle and tibia. No pitting noted either for edema. I'm just gonna palpate your pulses now again. I'm just gonna assess for the rate and rhythm of these pulses. So I'm just going to look at the femoral artery, which is +2 normal, popliteal, which is +2 and normal, the posterior tibula, which is +2 and normal, and the dorsal pediis, which is +2 and normal. So that's gonna complete our exam for today on the cardiovascular system. I didn't find anything abnormal with any of the pulses that I listened to, being the apex pulse, the radial pulse, brachial pulse, pedial pulses. Everything is normal. Skin tuber is also normal, no signs of dehydration. There's no other extra heart sounds. So everything looks good as far as this assessment. Is there anything else that you need?
No.
All right, this concludes it. Thanks.